thank you so much, Brian and Pam, for coming and talking about your, I know we have a lot of patients out there that they're not sleeping well. They're tired throughout the day. Some of these patients have worn a C-pap machine before, they've been treated for sleep apnea before, and they've not been treated maybe with good success. I know there's people out there that are going to watch this, and this is why I wanted you to kind of give me your testimony because it's such a great one. How many times, when you had your sleep study done, how many times an hour were you stopping breathing? Do you remember?
It was someplace between 50 and 60 times an hour.
50 and 60 times.
Every minute, basically. I would be holding my breath. When I did have the sleep apnea test done, it showed that my oxygen levels were falling in my blood. And I wasn't sleeping well. I'd wake up in the morning and not want to get out of bed.
And not want to get out,
yeah. So it was nice to find an appliance that works.
Awesome.
We, started back at the beginning here. I've been snoring probably for 10 years. My wife has worn earplugs most of that time. So once we started on this apparatus, I do snore a little bit, and then you can adjust it to correct that. But she doesn't wear earplugs anymore.
Wow.
So
how do you like that?
Oh, it's so much better.
Yeah.
I really I can sleep all night long.
Were you sleeping in another room ever before, or would the earplugs take care of it?
Well, the earplugs took care of it to a certain extent, but I could always hear them snore.
Isn't that crazy?
Yeah.
So that's good.
well, I would snore so loud, or I don't know, violently, I guess.
Yeah.
I don't know. I would shake. My head would shake.
Yeah.
I mean, I could feel it. I would wake myself up snoring.
And it's not just about the snoring. The snoring was a sign or a symptom of the sleep apnea where you're actually stopping breathing, and that's the dangerous part about it. But now you had a sleep study done, and you had a C-pap machine custom fitted for you. How long did you wear that?
Oh, maybe a month.
Okay.
It was very uncomfortable. You couldn't sleep. You couldn't roll over. If I'd roll over in the middle of the night and knock it off,
I see.
it just wouldn't stay. So I was constantly adjusting it. So it just didn't work for me.
It didn't work for you. Awesome. Well, and then we made you an oral appliance that holds your jaw forward, and that's the part that has minimized, almost stopped the snoring. It has absolutely stopped the earplugs, right?
Oh yeah.
Tell me how that's been for you.
No, that's been great. It's interesting when you talk about snoring. If I lay with my head to one side, I'll snore out on my back. If I put it on the other side, to my right side, I don't snore.
Yeah.
If I snore, or if I'm on my side, I don't snore.
And
So basically, I have stopped snoring. I mean, it's only when I get in a certain position, which is to be able to sleep all night long has been very nice.
Very nice.
When I wake up in the morning, I'm ready to get out of bed and start my day.
So let me ask you this, because before you were wearing the appliance and before you knew you had sleep apnea, how tired were you?
Oh, I could fall asleep anyplace. Yeah. I mean, I could sit in your waiting room and fall asleep.
Yeah.
And that's the truth. I mean, we would go, but she'd get mad at me because when we go to bed at night, man, I was gone. I mean, I just touched my head to the pillow and I was gone. She said, well, I know how I could go to sleep so easily. Well, I was tired.
Because you were never getting good rest.
Right.
And now, what's it like?
Well, no, it's great. I take care of this appliance better than anything. It has been a really wonderful piece of equipment.
Yeah.
I use it every night. I wake up in the morning, I'm ready to go. So, and it was you that convinced me to try this product.
Well,
and it was the right choice.
Awesome. There's lots of different products out there, and I think that the one we custom made for you is just perfect for you, and that's our goal with all of our patients, is to find the right appliance for them, and that's what we do here. And there's going to be people out there. I've talked to you quite a bit about the appliance before you move forward with it. What would you tell patients, or what would you tell people out there that maybe they're not resting well, maybe they're tired throughout the day, maybe when they get in the car and they're not driving, they fall right asleep, or maybe they have a C-pap machine they can't wear. What would you tell them?
Well, for me, the first sign was snoring. I should have gone long ago to get a sleep test, just to find out what was going on. But no, if you want to get a good night's sleep and you're not sleepy wherever you go, because if you go to my in-laws, I can fall asleep pretty easily. So I mean, it has changed my life quite a bit. I'm awake and not sleepy. I used to worry about driving in the car because I would get sleepy in the car. It doesn't, just driving. Yeah. It's not like that anymore. So no, it's helped us a lot. Well, especially my wife. She had to put up with all of my snoring.
Yeah. Well, and that's true. And the cool thing is that from a healthy standpoint, heart disease, blood pressure, number one reason for heart attacks is because of obstructive sleep apnea. You know, so many people are undiagnosed, and that's why I hope that we're able to get the word out, and that's why I appreciate you coming and share your testimony, because there's a lot of people out there that want to hear about this and need to know that there's something out there that can be treated. This is a new area of dentistry, and we like to be on the cutting edge, and I appreciate you guys very much. Now, I'm pretty sure that the patients can go to our website at chickashadentist.com, and that's where you can go to see this, or you can find us on YouTube as well at 29th Street Dental Care, and then Dr. John Phillips. So that's where you're going to be, and hopefully we help a lot of people because of this.
Well, if people are snoring, they're not sleeping well, they need to come see you.
Yeah, well, thank you very much. I appreciate it. Thanks, man.
Thank you.
You bet.